Hi, my name is Miranda Boudreau. Thank you so much for tuning into my research presentation. Today we'll be looking at using adolescents' internalizing problems as a measure for mood disorders and its connection to engagement and health risk behaviors. Let's get started. When I first began this project, it was important to review what the field already knows about adolescents and what knowledge gaps still exist. Why study adolescents? Well, the literature tells us adolescence, which begins between 8 and 14 and ends at age 19, coincides with significant developmental events, like the transition to high school and major hormonal changes that can induce stress during development. The perceptions of these stressors impacts how they're managed. Previous studies have demonstrated positive perceptions of stress being associated with healthy coping, whereas negative perceptions being linked to unhealthy coping. My research focuses on a category of unhealthy strategies, health risk behaviors, which are typically initiated at this time in development. As a result of these stressors, researchers like Kessler and McLafferty indicate that unresolved negative experiences during adolescence may manifest into mental disorders during young and adulthood. While it's important to identify disorders early, we find only an estimated 20% of adolescents who experience distressing symptoms receive a diagnosis. Thapper's research notes that criteria for many disorders are based on adult presentations, making several illnesses underdiagnosed in adolescents. They also highlight that receiving a diagnosis is an important step in qualifying for resources and treatment. Because many adolescents are likely to experience sub-threshold levels for mood disorders, namely depression and anxiety, it's important to consider other measures for identifying struggling individuals. Thapper's work suggests the usefulness of internalizing problems as a measure for capturing the spectrum of severity of mood disorders. Compared to externalizing problems, which are outward behaviors, internalizing problems are inner manifestations of one's mental state and are measured by scales associated with anxiety and depression, somatic complaints, and social withdrawal. Interestingly, Egger's lab revealed that somatic complaints, which are physiological symptoms like headache, stomachache, and musculoskeletal pain, are strongly linked to depression and anxiety disorders in both adolescent boys and girls. Next, we examine the importance of studying health risk behaviors, which are actions that adversely impact one's health, such as substance use or unsafe sex. Negative outcomes for engaging in these behaviors tend to disproportionately affect those suffering from depression and anxiety. Although many of these outcomes are largely preventable, they make up most causes of death and injury for adolescents. Because internalizing problems, particularly somatic complaints, seem to capture a bigger spectrum of depression and anxiety, and because those suffering from mood disorders are disproportionately affected by negative outcomes associated with health risk behaviors, we now look at how the present study relates these concepts. I'll begin with the hypotheses that were generated after looking at the literature. First, we use internalizing problems as a measure of depression and anxiety in adolescents, and therefore, high levels of internalizing problems would be correlated with high health risk behavior score. Next, we wanted to determine if certain subscales of internalizing problems were specifically correlated with engagement, and therefore serve as a better predictor of engagement. We hypothesized that high reports of subscales, in particular somatic complaints, which have been previously linked to anxiety and depression in both boys and girls, would be positively correlated with engagement and health risk behaviors. To answer these questions, we used data from a previously collected longitudinal study titled Neurobehavioral Detriments of Risky Behavior in Adolescents, led by principal investigator Young-Min Kim Spoon at Virginia Tech. They recruited 167 adolescent caregiver dyads and followed them for 4 years. This study utilized the fourth wave, where the average age of the adolescent was about 17 years old. Of the 167 pairs, 148 provided complete data for the purposes of this study. Here are the demographic breakdowns of the adolescent participants. Of these, gender was controlled for during analyses. Similarly, demographics about the adolescent's caregiver and family were collected. For this, Only income to need ratio was controlled for during analyses. Kim Spoon's lab collected data on multiple measures. However, this study only used a portion of those. First, to measure adolescents' internalizing problems, they used a modified version of the Youth Self-Report, or YSR. This questionnaire has adolescents report on their emotional and psychological state and includes somatic complaint like headache and muscle aches, anxious and depressed scales such as feelings of nervousness and tension, and social withdrawal, asking if they prefer to be alone than with others. Caregivers also reported on these same measures using the Child Behavior Checklist, or CBCL, but they were not used as we wanted to only consider the child's perspective of their mental state. Next, to determine engagement in health risk behaviors, data was collected using an abbreviated Youth Risk Behavior Survey, or YRBS. This measure was only reported by the child and asked questions related to their substance use of alcohol and marijuana and cigarettes, as well as risky sexual practices. Together, these measures determined adolescents' engagement and were controlled for by these variables. We analyzed these measures to answer our hypotheses about the link between internalizing problems and health risk behaviors. To answer our first and second hypotheses, we ran bivariate Pearson correlations against total health risk behavior scores to see if there was a relationship between internalizing problems and its subscales. We controlled for child gender and income to need ratio. Then we looked at subscales of health risk behaviors. For this, we calculated new average scores using questions that specifically concerned substance use or risky sexual activity. Again, we ran correlations with internalizing problems and its subscales against these new measures and controlled for gender and income to need ratio. As a result of these analyses, we found there to be statistically significant correlations between somatic complaints and health risk behaviors for nearly every group we controlled for. In contrast, we were unable to find statistically significant correlations for internalizing problems, anxious and depressed scales, and social withdrawal scales. Now, what do all of these results tell us? Well, for starters, it indicates that somatic complaints provide a robust measure for detecting at-risk adolescents. Although we're not able to determine whether somatic complaints cause engagement in health risk behaviors, they inform us that they could potentially be used to screen adolescents. This is particularly relevant as this relationship cuts across gender in most groups of income to need ratio, thus providing an opportunity for educators, healthcare providers, and other involved professionals to appropriately identify adolescents who may be at higher risk for health risk behavior engagement, even those without a mental health diagnosis. We now ask, where does the science and field go from here? This study was met with many limitations. Although most of the measures used in the study were reported by the adolescent, future research should consider using peer reports for increased validity. Additionally, there was a small sample for certain categorical variables, including poor and near poor groups, and therefore a larger sample should be used to increase statistical power of these results. Despite what the study was able to find, there are still many questions that need to be explored. Future research should look at this relationship for more diverse populations, including more participants with lower income to need ratios. Another important direction would be examining these correlations across different ages during adolescence. Additionally, potential moderators and mediators of somatic complaints should be examined, including the impact of peer and/or parental attachment on this relationship. Thank you for listening, and a very big thank you to the ICONS program, Kirby Dieter Deckard, and Young Min Kim Spoon for making this research possible.